the British Medical Association. In July this year, they passed a motion saying that withholding the results of clinical trials is research misconduct. Now, I think the big challenge in medicine, just thinking back to like the Cochrane collaboration forest plot, right? Problems in the information architecture of evidence-based medicine aren't as tangible as sources of avoidable mortality and morbidity. See, after so I've been taken aside by quite a lot of old men, mostly, not in a strange way. Well, in a strange way, okay, but in a kind of, look here, old chap, couldn't you just keep quiet about this? We were fixing this quietly behind closed doors. And we demonstrably were not, right? This problem was first documented in 1986 by Symes. The first call for a proper registry and publication of all trial results was in that year, and we have failed to fix it in the 3 decades that have followed. They've also said things like, look, why do you talk about avoidable suffering and death when the right terms are mortality and morbidity? And those are not the right terms. With evidence-based medicine, we have to do the opposite to what we do in A&E. I remember when I first qualified as a doctor, standing by a patient, trying to resuscitate them with somebody's wife on the other side of a curtain, crying and sobbing because she knew that the husband she'd loved for 50 years was dying, and she could hear the sucking noises and the things and people shouting instructions to each other. And we had to focus so hard, and it comes easy now, right? We're all psychopaths, but we had to focus so hard to not think about that sobbing on the other side of the curtain. And I think with evidence-based medicine, we have to do the opposite. We have to force ourselves to understand that these abstract statistics, these forest plots, they're not about lines on a graph. They're not about numbers on a page. They're about real-world avoidable suffering and death, and we have to fix it. In the newspapers, I can understand that crap surgeon kills patient is the only story they can understand about problems in medicine. But we, as people who understand evidence-based medicine, who understand epidemiology, I think need to raise our game. We need to recognize that where there are these things which lead to people making wrong treatment decisions, we need to fix them. And upstream, where people withhold the results of clinical trials from the medical and academic community, that is research misconduct because it has a negative impact on patient care as sure as if you were an incompetent physician there and then in front of your patient. So why don't you pass one to? I've just squandered my 6 minutes being sanctimonious. So this is Glenys Wilmot. She's a Labour MEP. She's really good. She fought the tobacco industry in Europe, and now she's the rapporteur on the new clinical trials legislation. If you want to find more about all the boring details of this, go to alltrials.net/news. But basically, we've worked very hard with her to try and change the legislation. This is only the legislation for new trials conducted within a European country, so it doesn't get us access to any of the trials from the past or trials conducted in other places, but at least she is helping to tighten up the law, so hopefully in the future we will get access to all the results of all the trials conducted within a European country. The European Medicines Agency have promised that they will open up access to clinical trial data starting from 2014, but that's only prospective, it's not retrospective. So hands up, who here prescribes only drugs that came on the market after 2014? And there you go, that'll be really helpful for everyone in about the year 2044. The Health Research Authority, fantastic. I mean, this is like a really sort of moving turnaround for me. I've sort of gone from carping from the sidelines to campaigning. So an organisation I was very mean about in the book have now come out and done exactly the right thing. And I was sort of in their press release saying, aren't you great? Hurrah. That felt weird. But anyway, so they've said they're going to make registration of trials a condition of ethics committee approval. They're setting new standards for dissemination, new mechanisms to audit compliance. So this is really important. Nobody was even monitoring properly to see if this was happening or not. Nobody was even monitoring to see if trials were published or not. One of the best things about the select committee is that at least MRC and NIHR bothered to do a quick audit and give a rough estimate of how many trials they think they've managed to publish and how many have gone missing in action. They're going to ensure that participants are offered results because participants are the most important thing in this story. And then they're going to work with regulators and professions to address the misconduct of withholding results. And I think actually, I don't know if you have like formal motions and stuff, but I think the Royal College of GPs should take a really robust stand on this and stand up and say, look, withholding clinical trial results is research misconduct and it's not tolerable for our members. So don't let any of this positive forward movement convince you that this problem is fixed. It hasn't been fixed. It needs to be fixed. And there are lots of things that you can do. You can sign up at www.alltrials.net. I'm very pleased to say that the Royal College of GPs has, but you all need to as individuals. You can support us at justgiving.com GPonline.com/alltrials. That's not because I want your money to put it in my pockets. It's because nobody fighting this fight gets a salary for doing so. So we'll do it in our spare time. I don't certainly want any money to do it, but we need campaign staff. We need people who can do posters and leaflets and badger people in Europe and take the train to Brussels and harass MEPs and do all of the stuff that campaigning requires. So please, I know there's a generational divide in GP land, a bit like with housing, and all people over 45 get about 100 billion pounds a year, and then everybody under 40 and sort of my cohort and below get salary GP, sort of a pitiful 60 grand a year. Anyway, teeny violins. Tell drug reps you have to sign up to all trials or maybe we won't see you. Tell them you have to audit your trials publicly, just to produce a proper number on how many trials you publish. Please don't sign any more silly documents pretending this problem doesn't exist. I don't know who the successor to Claire is, but it's really important. And actually, I think it would be really good to know how on earth you signed the first one. And it would be nice if you could reply to poor old David Carroll's email. Well, there you go. And if you can think of anything better, you tell me, what do you think GPs can do to fix this problem? Because we all aspire to practice evidence-based medicine. I'm the biggest evidence dork you'll find. I've put on a bit of weight. We can't practice evidence-based medicine in an environment in which half the trials have been withheld from doctors and patients and academics. So please sign up to alltrials.net, and sorry for barraging you and haranguing you. Thank you very much.